a massage stick. There are many of them out there on the market. Some, such as this one, it's called The Stick. It's got little rolling pins. Some people like that because they feel it gets in between and gets a better massage. Some are solid. Every brand is slightly different. Find the one that suits you. And what does that mean? It's just a way for you to maybe between our visits of physiotherapy or massage therapy to work out some of those kinks, help make sure the muscles are pliable, which will then permit your joints to move better, and also, of course, for many of us, less pain. So I'm just going to run through a couple steps with the stick of how you can use it from kind of head to toe to make sure that you're loose. Let's start with our arms. So if you take the stick and wedge it in your front hip, you can simply, again, keep this arm relaxed. You're going to roll up and down. And it's good to do at least 15 to 20, 30 strokes, or 20, 30 seconds per area. I can turn my forearm a bit to get different areas, but I'm getting my wrist flexors, my gripping muscles across the front of my forearm here. I'd switch sides to now catch the outside forearm muscles. I'll turn a bit to get over top of this ridge here, that muscle that helps lift this way. So I can roll it, I can make a fist, I can add wrist movements into this, which becomes a little bit like a self-release or an active release technique to it. Just up and down. So that's that tennis elbow stuff that people talk about, or a lot of typing and tension. If you go up the arm, if you've got the flexibility, you can anchor it on you or chair, but you can get your bicep, and you can again pivot your arm back and forth. Same goes for the tricep or for the back of the arm. I sometimes like to sit on a staircase, and then I wedge this stick into the step above the one that I'm sitting on, and then I can really get in there. If I had one, I could get the whole back of my shoulder area through there. For the neck, you can grab it with both hands. Just make sure you're not awkward in your posture, but you can roll left side, right side, getting right up, not just to the base of your skull, but get onto your skull a bit, because that big upper fibers of trap muscle that you have doesn't attach here. It actually attaches on that bony ridge that we all have on our skull. So you want to make sure when you're doing it that you go right up past that bait behind the ear, onto the skull a little bit, doing both sides of your neck, holding it as best you can. Okay. If something's really tight, you could put it on a gentle stretch while massaging it and see how that feels. Just make sure that you're relaxed and you're not tensing up with it. For the back, if your stick is long enough, so this is a pretty short stick, and I have a lot of flexibility in my shoulders. You may not be able to do this, but this is how you get into your back. Is one hand overhead, one hand below. I like to keep the bottom hand stable, anchored, and the top hand rolls in and out from basically your spine to the shoulder and back. And again, 20, 30 strokes through there. I can take the stick and go behind my back. I can do my low back. I can do my mid back. If I hook into my elbows, I can get my back taken care of. When it comes time to the leg, I like to stand up and put my foot on something. It keeps my leg relaxed, and then from there, I can roll. You could do this seated as well, but I roll the outside of my thigh, 20 or 30 strokes. Top of my thigh, 20 or 30 strokes. Inside thigh, 20, 30 strokes. And then you could go the same thing underneath. Remember, there's all sides, not just 1, 2, 3, 4. Angle it. If you find a spot that, oh, that's tender, then focus in on it. Maybe start broad, but really get into that zone. Same goes for inner thigh. In this position, you can do your calf, so the back of your lower leg. You can angle it and catch those peroneal or everter muscles across the outside here. You can do the front of your shin. Now remember, you've got a bone that's here. Don't roll right on that bone. Come slightly outwards so that you catch the muscle bulk. If you roll the bone, it'll be tender and you'll probably develop a bruise. So I can do that. This can all be done seated just the same way. I could add movement to it. If you know what active release and self-release is like, you could do that. You can do it with your calf. I could go up and down with my calf as I roll. Find that tight spot. I have one here, and roll, 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 roll. So that is how you can use a stick.